If you are watching this morning and you or someone you know is suffering with cardiovascular disease, you know that it impacts all parts of your life, and having a physician you can trust is a key part of your care. So we're so happy to have traveled down to Phoenix Cardiovascular Institute in Ringgold off of Battlefield Parkway, I guess technically Fort Oglethorpe.
Right.
Talking with Dr. Dennis Hood in his office. So good to see you, and thanks for letting us come in.
Thank you. Thank you for coming.
The office here in Fort Oglethorpe is somewhat new. Y'all came here in December. You, however, are a very familiar face in these parts.
I actually grew up in Lafayette. So I went away to school, went to University of Georgia, then went to Medical College of Georgia. From there, Bowman Gray, came back to MCG, did a residency, then a chief resident year, and then went to Medical University of South Carolina and the University of South Carolina in Charleston.
It would be interesting to have a long conversation with you to see what the treatment of heart disease looked like when you first got to the Medical College of Georgia versus now, because we've made a lot of headway in how we can treat this issue.
Yeah, it has really changed. When I was a medicine resident, we were more concerned with thrombolytics, TPA, and the origin of what is the plaque, what is the nidus or the event that causes the myocardial infarction. And at one point in time, they were even touting that that infection might be a cause for coronary disease, and they were even suggesting antibiotics. There was more concentration in plaque and plaque rupture and platelets.
Well, let's talk about that, because already we're, what, a minute into our conversation,
Sure.
And you're throwing out terms that you know quite well, but the average person doesn't. And I had told you before we began talking that when you discuss heart-related issues, it's very complex, because the heart has so many different components to it that somebody watching today could be having issues, but theirs could be very different than their next door neighbors.
Yeah, I think people don't understand that coronary disease doesn't start in your 40s or 50s or 60s. And people nowadays are actually presenting to the emergency department earlier, in their 30s, and sometimes even in their 20s, late 20s. Coronary disease actually starts in your teens, and it starts with something called a fatty streak. That is just a streak of yellow in the inner lining of the coronary arteries and the aorta. And then from there, it progresses. A lot of coronary disease is sort of like rings on a tree. So if you look at the coronary artery, you can tell how long somebody has had coronary disease.
So are you suggesting that if you looked at one of my children, 19 and 26, as young as they are, if they had the right scan, you could see if they have that sign, that fatty streak?
Quite possibly. Quite possibly. So if they don't have that kind of scan right now, but if you took a camera in and photographed the inner lining of the artery, like an angioscope, you can see initial changes in some people.
So, I mean, we could talk 15 different topics and never reach them all this morning. So let's talk prevention for a little bit, if we can. It's a big thing for me. My dad died in 1981 of a heart attack. This is before bypass surgery was like the cutting edge thing. Now it's standard procedure.
Right.
So prevention's really important to me. Most of us maybe know our numbers, right? Our cholesterol, blood pressure. That doesn't always tell us everything. Is that right?
Yeah, that's true. And regardless of the numbers, everybody has to really think about the basics. Yes, you do have genetics that you can't change, but there are mitigating factors that you can, like, for example, smoking and the types of foods that we eat. We've been talking about so many different types of diets over the last 20 to 30 years. The ADA diet was popular and still is popular with diabetics. Now it is the Mediterranean diet, and actually there's some literature now that supports the Mediterranean diet as improving cardiovascular health and helping achieve longevity as well. So as far as changing your lipid levels, we are very aggressive now with watching the cholesterol level, the triglycerides. The HDL, or the good cholesterol, is important, but maybe not so much. Statins are very, very important, and I know that statins have gotten a bad rap over the last couple of decades, especially since Baycol in the late 90s, but are still quite vital in slowing down the process of coronary disease. And now we've got the injectables as well.
Back to the scans, you mentioned what I had suggested for my daughters don't exist yet, but it may one day. You are doing scans here at your clinic for people. What are those scans taking a look at?
So in having somebody who comes in with risk factors, but may not have any symptoms of coronary disease, at the outset we'll get an idea of what their cholesterol levels are. We'll want to make sure their blood pressure is normal. We'll take a detailed history and look at their family tree. And then we'll also do an exercise stress test. If everything is normal, we may suggest a calcium score. And if they come to us already with calcium on a CT scan, which is more typical now than in the past, then we may go for a coronary CTA, which is a virtual angiogram using CT scanning.
If you have that calcium, are you going to have physical signs that let you know you've got this calcium buildup?
So by definition, if you see calcium on your coronary arteries, you do have coronary disease.
But will you feel that?
You may not. And that's the thing, is that we'll get a lot of folks who will come in and they'll be completely asymptomatic. And some of those people have coronary disease in vital places that put them at risk for an acute event. There's that term that everybody puts out called the widowmaker. And there are some people walking around with critical coronary disease and that is not picked up. 50% of folks have something called silent angina, where they don't have that classic chest discomfort or chest tightness, and they may not even have shortness of breath.
So you could be going to your GP, everything could look fine in your life, but maybe you have a history in your family of heart disease, or you just are watching this hit your friends at younger and younger ages. They can come to you and have an appointment and maybe get one of these scans just to see?
Certainly.
Okay. Before I let you run, because I know you've got a long line of patients out there waiting to see you, risk factors or symptoms of heart problems, men versus women. Not risk factors, but signs of heart disease or a heart attack, men versus women. We experience it differently?
You do. Men actually show up earlier than women. Women will show up a little bit later. Women will present differently. They may have edema in the legs. They may have shortness of breath or fatigue, or have what they describe as palpitations. They may feel their energy level lowering. And some people do have chest discomfort. Some women do have chest discomfort, but there is a proportion who has actually pain in the back, around the shoulder blades, the neck, the teeth. They may think they've got a sinus infection, and it's radiated pain up to the jaw.
Wow. And then men, it's the classic
It can be.
arm and...
It can be, but also it can present in a plethora of ways. There's a friend of mine years ago whose patient was berating his dentist and said that he'd had his cavity fixed and still was having problems with his tooth. And actually, the tooth pain got fixed with a coronary stent.
So we could stay talking for a long time, but the point is your heart health is totally unique to you. So this was kind of an overview conversation today with Dr. Hood, but if you want to come in and get one of these scans done and just kind of begin having that peace of mind or the knowledge of what's going on with your heart, this is the place to start it, and then you can know how to build your healthy years moving forward. So thank you so much for your time.
Thank you. And I'd like to say that Phoenix is more of a metaphor for renewal. And anyone, any cardiologist who is an interventionalist can put a stent in. The stent or the coronary bypass just takes care of the immediate problem and the mechanical problem. But you cannot ignore the overall cardiovascular health because the process needs to be addressed after the mechanical fix.
Thank you.
Thank you.